Mr. Chairman, for a little bit of history on this, the Affordable Care Act is what eliminated the sole community provider program that we were using here in Doña County. That program allowed the county to leverage monies with the federal government on a 4-to-1 ratio. And then the hospital, because it was designed to help hospitals that serve large indigent populations. And that is a requirement in the Constitution of New Mexico for the counties to serve that indigent population. The new safety net care pool leverages state and federal monies, but at a much smaller ratio than what the sole community provider program did. For example, the largest hospital in the area, MMC, used to receive about $35 million through the sole community provider program to serve that indigent population. Now, it's about $13 million less, and so that's one of the things that we see going on with MMC as they're looking to change or to make amendments to their contract along those lines as well. About 2/3 or half as much as they were getting before. Keep in mind that with the expansion of Medicare and Medicaid that the federal government has done and that the state of New Mexico has accepted, somebody's got to pay for these things. What was happening before with the sole community provider program is that once the federal or the county's money was leveraged at a 4-to-1 ratio, then the hospital would make a donation back to the county of a portion of the county's money that we used for the match. And so I'm not quite sure how great that is, but for the county it worked real well because we got the federal dollars to the hospital to cover the needs that they had there, and then we're still able to retain the county's money to put to other uses. I don't have a problem with this resolution. I think it's important that we try to keep the state from taking more money, but I think it's also important to realize that the Affordable Care Act is anything but affordable, and somebody's got to pay for these things. So I know that's one of the things that people are looking at. I talked with Charlie Marquez and Steve Kopelman. Charlie Marquez is the county's lobbyist. Steve Kopelman is with the New Mexico Association of Counties. Both of them indicated that no legislation has been introduced this year to change what's currently happening. So hopefully this isn't an issue that we're going to have to focus on real quickly. But the expansion of the Medicaid from the federal government is neither affordable nor sustainable, and I know that we'll be seeing more changes down the road on that. Mr. Chairman, thank you.
Thank you. I'm going to hold back on any comments. I'm obviously in support of this. I was involved with NMAC for 3 years. I know that many times we are simply reacting to things, whether they're federal or whether they're state or whether they are regional. We do the very best that we can with what we have available to us. But don't take any more away from us. And we want to encourage our legislators to please pay attention and stop creating these unfunded mandates. Any conversation on this, any input from the public on this particular subject? I'm being very patient. I see no input from the public. Any further comment from the board?
Mr. Chair, I'm curious if there's any input from staff.
Good question. Thank you. Staff? Ms. Michaels, do you serve on the committee? The committee?
Yes, Commissioner. Jamie Michael, County's Health and Human Services Department. I serve on the NMAC Health Policy Committee with Commissioner Garcia and County Manager Brown, and I believe she covered it. We do have an indigent gross receipts tax, and the state is currently taking a portion of that, so that leaves us with less money here to provide some of the still needed care for people who are under or uninsured. But on the other hand, we did see a big boost of the number of people that were covered by the Medicaid expansion.
So that was helpful for us.
That was very helpful.
Very good. Thank you.
Thank you.
Thank you, Ms. Brent. Thank you. Any further comments? Staff? Public? Board? Very good. Let's poll the board, please. Thank you.
Commissioner Garrett.
Yes.
Commissioner Rawson.
Yes.
Commissioner Garcia.
Yes.
Commissioner Benavidez.
Yes.
Mr. Chairman,
Yes.
the resolution is approved.
Very good. Thank you.
And Mr. Chair, for the record, that item needs a resolution number 2016-14.
2016-14. Very good.